a sore or erosions that occur on the lining of the stomach, intestine, or in the esophagus or on the esophagus. The main cause of this peptic ulcer is due to the overaction of the acid peptide juice. When your stomach produces a lot of gastric juice, it will actually break down the lining of the stomach and you will form an ulcer. So this is the simple introduction about what is a peptic ulcer. So when a person getting a peptic ulcer, you will be experiencing like burning epigastric pain. You will be feeling very intolerance to some food like fatty food, and they will be feeling of fullness, bloating, or bleaching. It's very rare for the patient to be vomit lah, but sometimes the patient will experience vomit of blood that is due to the bleeding inside the stomach, but it's a very rare lah. So we move on to the etiology. There are two main causes why this peptic ulcer can form. One is a H. pylori infection. The other one is we are taking about the NSAID medication. So we go through these two etiology more detail. So for the H. pylori infection, we know that H. pylori infection is a bacteria. So this bacteria actually they will go into our intestinal lining and it will release some toxin. Example of toxin that release is called the cytotoxin associated gene A and also the VACA. This will cause our stomach lining to be damaged. And when there is a damage, so our body will try to compensate to it. So they will release of some chemokine and then will initiate the innate immunity, and this all will lead to a ulcer in the stomach. And the other common reason is we are taking about the NSAID drug. The NSAID drug, especially for non-selective NSAID drug, for example, like aspirin, when we are taking this NSAID drug, their mechanism of action is that they inhibit the COX enzyme. So for non-selective one, they will inhibit both COX-1 and COX-2 enzyme. So for the COX-1 enzyme, one of the important function of COX-1 enzyme is that they will release the prostaglandin that will help to protect our stomach lining. So when we are taking the aspirin, which is the COX inhibitor, so when they inhibit the COX-1 enzyme, so these prostaglandin are unable to synthesize. That's why our stomach will have low protection. And then they will lead to the ulcer formation. And the other etiology, like when we're taking some other medication like steroid or anticoagulant, low dose aspirin, together with NSAID, they will also lead to a peptic ulcer and increase of the acid secretion, decreased mucus secretion. So when that is similar to the NSAID drug, this mucus is actually a protecting lining, protecting to our stomach lining. So when there is a less mucus production, so less protection, and then it will lead to the peptic ulcer. And for smoking, you know that smoking can induce an inflammation. So I got when there is an inflammation, there will be release of some of the chemokines, and then there will be innate immunity, and you will lead to a ulcer also. So who are at the risk for this peptic ulcer? For a patient that is regularly taking this non-selective NSAID, and then the patient that is smoking, they drink a lot of alcohol, they have untreated stress. So actually the stress also can induce the peptic ulcer. That's called the stress-induced ulcer. And if you're eating too much of spicy food, this one, when you eat more spicy food, they will actually increase your acid pepsin secretion. So when more acid is there inside your stomach, so we'll have a higher chances of getting this ulcer. Okay, I think that's all for my part. I'll pass to Tan for complication.
Yeah, good morning, sir. I'm Tan, and I will be talking about the complication of peptic ulcer. So, in general, if the condition of the peptic ulcer getting deteriorated, it may result in internal bleeding, causing blood loss, and a slow blood loss may cause anemia, and a severe blood loss may result in a bloody vomit and bloody stool, and blood transfusion may be required. And next is the perforation. That means a hole will be formed in the stomach wall, affecting the stomach wall as well as the small intestine. And this may also increase or elevate the risk of infection inside the abdominal cavity. In other words, peritonitis. And obstruction in the GI tract or digestive tract may occur, and it may block the food passing through the digestive tract. And worse, it may cause gastric cancer. And most probably, this is infected by the gram-negative bacteria, H. pylori. Yeah, I will pass it to the next presenter to talk about pharmacotherapy.
Hi, I'll present about pharmacotherapy for peptic ulcer. There are 5 classes of drugs that can be used to treat peptic ulcer. The first one is antacids, aluminium hydroxide. Hydroxide gel is one of the examples that's under this class. It's a weak base that can neutralize acid. It means that it can react with gastric acid to form salt, which means it can lower acidity of the stomach and can treat peptic ulcer. We also inhibit the formation of pepsin. Take this drug 5 to 30 ml between meal time and bedtime. Yeah. The common side effect found in this class antacid is constipation and diarrhea. These two are the most common side effects found during taking the antacids. Next one is H2 antagonist, cimetidine, ranitidine, etc. These two are the examples that put this under this class. H2 is histamine, by the way. So the mechanism of action of this is H2 blocker. It will react with histamine for the H2 receptors in the stomach of the perishal cells, and it will depress the production of HCl. Basically, this drug will react in the histamine in the the receptor in the stomach, and then it'll block the production of acid. That's what it basically means. Okay, reduce acid and provide pain relief and encourage healing. Cimetidine and ranitidine. Ranitidine I didn't put because it's banned. So yeah. So cimetidine 400 mg twice a day with breakfast and bedtime. Treatment dose 150 mg orally twice a day. Maintenance dose 150 mg orally once a day, bedtime. The common side effects found in this class is the constipation, diarrhea, dry mouth, headache, insomnia, etc. Okay, third class is omeprazole, lansoprazole. These two are the examples that put under this class. They reduce stomach acid by blocking the action of production acid. The basic for the mechanism action, let me explain in detail. It's a coated prodrug that remain inactive until they reach alkaline environment of the duodenum, and then it will be absorbed and transported to the perishal cells, and it will irreversibly bind and inhibit perishal cells HK-ATPase, and it will reduce the secretion of hydrochloric acid in the perishal cells in the stomach, and it will treat the peptic ulcer. The common side effects found in the proton pump inhibitors are like diarrhea, headache, nausea, vomiting, fractures, kidney disease, etc. Then zoom in a bit. Then zoom
Yes.
a bit. Zoom a bit.
Or Zoom.
Yeah. Okay, enough. Thank you. Okay, omeprazole, lansoprazole, I also got put the dose 40 mg for omeprazole, 40 mg orally once daily up to 4 to maximum 8 weeks, and for lansoprazole 30 milligram orally once daily up to 8 weeks. Okay. Next is cytoprotective agent. One of the examples is sucralfate. It functions to protect the stomach lining and small intestines. For mechanism action, it stimulates proteins at ulcer site, form protective coating against the gastric acid, pepsin, and bile salts. It also inhibit pepsin, exhibit cytoprotective effect, form viscous adhesive barrier on surface of intestinal mucosa and stomach. And or in other words, it dissociate in acidic environment and stomach to an ionic form and bind to the ulcer to create protective barrier to pepsin and bile, and therefore inhibits diffusion of gastric acid. So sucralfate, you take 1 gram orally 4 times daily up to 8 weeks. The common side effects found in these drugs are constipation, indigestion, backache, stomach cramps, pain, nausea, vomiting, diarrhea, etc. Okay. The last class of this pharmacotherapy for peptic ulcer. Oh my god, I cannot pronounce. Is antibiotics. You only take antibiotics when there is a high H. pylori found in your stomach. Is a kind of bacteria. Antibiotics is function to kill the bacteria found in your stomach and reduce stomach acid and protect stomach lining. Antibiotics is also used for combination therapy if the H. pylori found in your stomach. I give 2 examples under antibiotics, which is amoxicillin and clarithromycin. Take 1 for amoxicillin. Take 1 gram orally every 8 hours for 14 days in combination of lansoprazole. For clarithromycin, 500 milligram orally every 8 hours for 14 days in combination with omeprazole. Okay. Lastly, most common side effect found when taking antibiotics is abdominal pain, loss of appetite, diarrhea, bloating, indigestion, etc. So I think that's all for my part in pharmacotherapy. I'll pass back to Tan for prevention and non-pharmacotherapy.
Yeah, back to me. And yeah, I will be talking about the prevention. Yeah, I will be talking about prevention of fatty ulcer. So, what should we do in order to prevent fatty ulcer? And first of all, we need to be aware of all the precaution steps whenever taking pain reliever, such as NSAID, ibuprofen, as mentioned before. And we can actually take the pain reliever together with the meal after the meal. Next is to avoid the alcohol. The alcohol consumption should be reduced and limited and even avoided because it may be harmful to the GI tract or the stomach. And if you feel like your stomach is not feeling well, maybe you can consult with the doctor or pharmacist, and perhaps they will ask you to take antacid to reduce the stomach acid level. And apart from that, we should also protect ourselves from getting infected by certain bacteria, especially H. pylori. And we should enhance or take care of our personal hygiene. Washing our hand more frequently, using the soap and water, and sanitize our hand by using the hand sanitizer. And before eating the food, we need to ensure that it is completely cooked so that all the bacteria inside the food can be killed. And moving on to the non-pharmacotherapy, yeah, actually it is quite similar to the prevention step. Yeah, so as a pharmacist, we can actually provide some counseling to the patient and advise them to helping them to reduce their stress because as mentioned before, the stress is one of the major or main risk factor of getting fatty ulcer. So maybe we can ask them to do more exercise or read some book or listening to some music. Yeah. And next is to avoid smoking. So try to avoid smoking if possible, and same goes to consumption of alcohol to be avoided as well. And the patient can be advised to wash their hand more frequently as well, to use by using the soap and water or hand sanitizer. And most importantly is to maintain a healthy lifestyle and balanced diet. Try to avoid spicy food, curry, yeah, that kind of food like fatty food, pizza, burger, nugget, that kind of food should be avoided. Yeah, some people say nasi lemak without the sambal is not considered as nasi lemak. But as a pharmacist, we should advise the patient to avoid sambal when eating nasi lemak. Yeah. So try to take more vegetable and fruits to maintain a balanced diet. Yeah, I think that's all from our group. Thanks for listening.
Okay, thank you. Thank you for the group. Okay, the poster is very good. Okay. Okay, so we have to avoid the nasi lama. Okay, we should stop eating sambal. Only eat nasi
Yeah, avoid sambal.
and sambal. So okay, okay, so based on the your presentation. Okay, so we know the cause of peptic ulcer. So what is the usual cause of peptic ulcer? Most of the cases, why they have this peptic ulcer?
It's due to the H. pylori infection, or it might be due to the use of NSAID drug. But most commonly, it's due to the H. pylori infection.
Okay, so yes, right. Okay, so that's because of H. pylori, as we already studied about this. And so why H. pylori is good bacteria? Why it causes ulcer? Yes.
Uh, because bacteria have their own normal flora place. So when the bacteria, when they go into a not their normal flora, so it will cause some disease lah. So for
Right.
example, like the Streptococcus, the Strep aureus, they normally live on our skin, but when they go into our blood, they will cause sepsis. So it's like that lah for bacteria.
Okay, so because H. pylori already there, everybody got H. pylori. Okay, so but it can cause ulcer only in some cases because of so many other factors that can lead to H. pylori. Okay, so that's about okay for me. So good presentation. Okay.